So that's a great question. How do you find the right provider for you? I think I'll approach that from a physician perspective. There are so many choices out there. Um, I really think that everybody would benefit from having what we call a primary care physician or primary care provider, somebody that is trained in one of the primary care specialties, like family medicine would be my preference, or internal medicine, which is kind of like especially appropriate for those elderly population, no obstetrics and gynecology, and much more of an expertise in the types of diseases that affect the elderly much more so. But I think that when it comes to that looking for that provider, you really should maybe start by asking around. Some of the people I like to ask when I'm new to a community is to contact some of the nurses or other doctors who work in hospitals and who has a great reputation amongst the profession of other physicians and nurses and so on. And who do they go to? Who do they see? And I'm looking for somebody that's esteemed well within their own profession and in their own community. And sometimes word of mouth is really one of the best resources for that. And so that's kind of one of the ideas and thoughts there would be how are they esteemed by their own peers?
Yeah, we actually have a neighborhood connection that I have reached out to for different kinds of care, medical or dental, and it's been a great resource to to go to hear what other people are saying. And there are things online that where you can read about people's experiences with doctors, and that's been helpful as well.
Yeah, there's applications and numerous websites now that give health grades to providers, and I don't know about the grade as much as looking at the reviews, just like on a product, or a service, to look at what people are saying about their experience. And I remember when we went to one of those next door apps and people were asking, who's a good dentist in our community?
Yes.
And it was amazing the number of people that recommended the same dentist and said, well, that's where we want to go.
Yeah. And I've
So
had
that's a great
experience,
resource.
yeah.
So when it comes to getting referrals, usually you're going to want to go through your primary care physician. And they function really kind of like the hub on a wheel. And you don't need to go through CHM to get approval, pre-authorization or anything like that when it comes to going to specialists. I will say that as a trained family physician, that at least 80 to 85% of medical problems that people face can be addressed adequately, more than adequately, and by a family physician in our training. And then that 10 to 15% or so that need really specialty consultation, the vast majority of the time, really, the family physician can refer you to the specialist, and they're going to tend to know the best ones to get you into. And oftentimes it's just to get their opinion on something, and then you come back to your primary care provider for ongoing care after that. The vast majority of referrals are just consults and getting an opinion, and then plugging back into your family doc.